My name is Gasia Mikaelian, and I'm at KTVU Fox 2 News in the San Francisco Bay Area here in California. I'm happy to welcome to the discussion Juliet Alperin, Senior National Affairs Correspondent with the Washington Post. Juliet, thanks for being here.
Thank you.
You've been looking into the fact that many are concerned that there doesn't seem to be a national strategy for testing as it relates to COVID-19.
Yes. So, we're in this situation where obviously this pandemic is affecting different parts of the country at different times. And so states are struggling to see how they can provide, and track the spread of the disease in their areas. And usually when you have these kinds of national emergencies, there's a coordinated federal response. Now, of course, certainly the White House and agencies are working on this, but there's no unified strategy for how should we determine whether people have the novel coronavirus, how it's spreading. And so that certainly is creating these disparities across the nation.
Where I live in the Bay Area, some cities have set up drive-through testing. Sometimes the testing is only for frontline medical workers. You wonder what's happening in other cities and areas because, there are parts of the country that haven't been hit very hard by the coronavirus. Then there are others, such as my area, your area, New York, New Jersey, up in Washington State, that have been devastated by it.
Right. So what we're seeing is that, again, for some of the most hard-hit areas, and certainly, California is a great example of this, they've decided that they need to devise their own strategy. In fact, one of the advisors to Governor Newsom said essentially they were doing this because the federal government was out to lunch. Now you certainly are seeing a similar effort underway in, again, some of these hotspots, whether you're talking about New York, Connecticut, Rhode Island, and so forth, again, in Washington, D.C., and in the particularly surrounded by Maryland and Virginia, they're also both trying to coordinate and have some kind of overarching support. But then you do have some of these states, whether they're, more rural or for political reasons, their governors have been more reluctant to institute statewide measures. You have much less of an overarching strategy. And there we're seeing, individual cities often take action, but not the kind of statewide response that you're seeing elsewhere.
I know you've seen exchanges between our governor, California Governor Gavin Newsom, and President Trump as it relates to the coronavirus pandemic. Usually these two are at odds. They've had some nice words for each other. So my question to you is, in those states that aren't getting the help that they need, you mentioned there might be a political aspect. Is there a political bent to those states not getting the help they need, whereas other states are getting the help they need? Or is it just purely logistics?
Well, actually, there definitely are political calculations going on here. And sometimes the president has actually been pretty explicit. He says he likes hearing that governors appreciate him. And in fact, he bristles when he does get criticism and has been very harsh on, in terms of how he's described some governors who have disagreed. And so what we have seen is, for example, he's gone out of his way to help Florida, where Ron DeSantis, the governor, is an ally of his. And also that's obviously a pivotal state for 2020. What I think is interesting, and what you alluded to, is there are some Democrats who often have real policy differences and in some cases have real concrete differences about how they want to approach coronavirus or what kind of support they need. But they tend to be pretty careful nowadays about what they say about the president because they realize that there could be real consequences for being as explicitly critical as they might be in another situation.
Can you, go back in your reporter's mind, the last time there was a crisis, maybe a natural disaster, a hurricane, September 11th, did the federal response depend as much on the political situation, or was it Texas needs help, let's get help to Texas no matter what?
Usually politics are put aside. I think in almost all natural disasters, we see this. In September 11th, granted, initially you did have a Republican mayor, Rudy Giuliani, but everyone knows that New York City is an overwhelmingly Democratic state, and there was no question that George W. Bush at the time, was fully committed to helping it recover, and others who were affected. So usually politics does not play such a big role. You usually see it as a moment where people rally around and really respond to whatever place is afflicted by a particular disaster.
So, in the absence of a national strategy for coronavirus testing, are there states or areas that you've identified that should be of particular concern that maybe aren't on Americans' radars?
Right. So I guess a couple of places that certainly popped up when we were looking at it is Texas and Georgia are two states where the rate of testing is extremely low when you look at their population. And you're talking about places where, first of all, there have been real hotspots. For example, in Southwest Georgia, around Albany, there's particularly, it looks like there was one funeral where someone was positive for COVID-19 and it spread rapidly. And so you have some of these, quite populous states where they're not testing comprehensively. There's a real concern that the virus could be spreading in a way that's not being fully detected. So those are a couple of the ones that really rank pretty high up there when you ask experts.
I know that our governor here in California has said that he expects coronavirus cases to peak in mid to late May. That's coming up pretty fast. Is there any sense that even if there were to be a push for a nationwide, test system, that it's kind of, shutting the barn door after the horse is out?
So there's some experts who say that, including, for example, an expert I talked to at University of Minnesota who had advised the George W. Bush administration and other administrations on how to respond. Part of what they say is when you have widespread infection, and as you're saying, when you get to the peak, widespread testing isn't as valuable. The flip side of that is almost everyone agrees that you need to put a system in place so that there can be widespread testing later this year, when, regardless of what happens in the next few months, the virus is poised to resurge. And so part of the sense is that one of the reasons you want a national strategy, experts say, even if it's not going to have quite as much of a difference in the hotspots that are almost at their peak, is that it could both still make a real difference for plenty of places and also help position us for the fall when we will be likely grappling with this again.
So let's just say that, this interview, caught the White House's ear. Who in the White House, in the administration, is it a person, is it a department? How would such a national strategy get launched?
Well, there is the coronavirus task force, which obviously the vice president runs and has top advisors, including the White House coronavirus response coordinator, the assistant secretary of Health and Human Services, and Admiral Brett Giroir. So these are the folks who are, first of all, right now debating behind closed doors whether they should have a strategy and would take the lead. It essentially would be championed by folks, the top officials at HHS, at the Centers for Disease Control, and the National Institutes of Health. Those would be the folks who would likely be tapped to do this.
And finally, Julia, because I have you, you're talking with us from Washington, D.C., from that area. Can you just give us a slice of life of, when you go out to the grocery store, are people covering their faces? Are people sheltering in place? What's daily life like for you there?
That's absolutely what it's like. It's really interesting. We, obviously are further behind the curve than you are out in California and in the Bay Area, but people really here have been taking social distancing quite seriously. So that's what you have, it's interesting. But even, I've noticed in we had been reporting on what was going on with mask covering and the emerging guidance there. And even in the difference between once CDC came out and they suggested, even as the president said he wasn't going to follow that guidance, you really saw many more people now covering their faces when they're out in public. People do keep their distance in the grocery store. Schools are out, and while they haven't right now, they're just out to the end of the month. The broad expectation is that there will be no more school for the rest of the year for kids here. So people are seeing this as a real. And that is again the reality of working from home. So basically, people are taking it seriously, and it's the understanding is that this is the way life is going to be for some time, because we're not expecting a peak till June. One flip side of that, I should say, however, is that you do have a number of federal workers who are still going to work. So that is the one contradiction we have, and that is unusual about the United States and DC in particular, given that we're the nation's capital and people expect the federal government to keep functioning. there are more people going to work at the federal government than you might expect them in this situation.
Interesting. Well, good to know. I love the firsthand experience story. And look, I've got two little boys having their own classroom Zoom meetings at the breakfast table as I speak. So it's a joy to talk with you, Juliet Eilperin, Senior National Affairs Correspondent with the Washington Post. Thank you for joining me.
Thank you.
Of course, and if you'd like more information on this, you can always find it at coronavirusnow.com.